Rosemary oil. It's just an essential oil that you buy for about $5-6. And what you do is you take the oil, 3 to 5 drops per, I think, an ounce or so of shampoo. Put it in your shampoo, and rosemary oil helps increase circulation. Or before shampooing, you can take a few drops, rub it in your hair real good, really circulate it in the scalp, and it helps take off some of that buildup and also increases the circulation to the scalp. Natural progesterone cream. When women are going through menopause and perimenopause, and as noted before, they oftentimes have a drop in their natural progesterone levels, and with very environmentally estrogen dominant in our food source and everywhere else. Dr. John Lee did most of the studies on that. When we add in progesterone cream, we see hair loss slow, and I know me personally saw actual hair increase with utilization of natural progesterone creams when you're not in balance. Zinc and copper. And you want to, whenever you take a zinc, it's always a good idea to take a copper balance. They work together. You can offset your levels of zinc and copper if you don't take them together. Aids with hair growth. Digestive enzymes. If you have poor nutrient absorption, you don't digest very well, enzymes, or there's also something known as probiotics, Acidophilus bifidus, those good bugs, those good bacteria, can help you break down those nutrients to aid with nutrient absorption. A good multiple vitamin and a B complex. With today's food, and I was in agriculture for a lot of years, the quality of the food as they throw on very few things onto the crops just to make them green and bloom is pretty nutrient deficient. So nowadays a really good multiple, and I mean a good multiple, not something that's going to come out and be in the septic system. A good multiple vitamin with extra Bs can be very helpful for hair loss. A lot of the hair, skin, and nail formulas that are out there will be a multivitamin that's got extra B vitamins, and oftentimes some combinations of some of these other items as well. Super greens. Now you can either eat super greens in a food source, which are broccolis, and preferably organic, once again, because we're trying to avoid the chemicals. Broccoli, green leafy lettuce, anything that's green oxygenates and increases circulation. If you're not a good veggie eater, it helps with fiber and everything and enzymes, but there are some helpful things such as chlorella, spirulina. A lot of people do their wheatgrass shots. Anything that oxygenates in greens will help with hair growth and prevention of hair loss. Sublingual B12. We have people who have poor digestion, especially in the lower part of the digestive tract, or people who have gastric bypass. Oftentimes will be B12 deficient. And there's just a simple sublingual under the tongue, meaning it melts, takes 10 or 15 minutes to melt, can help with hair loss prevention as well, particularly in those gastric bypass patients. Other contributing factors that we see to hair loss are lack of sleep. Be gentle when you comb your hair out, especially when it's wet. If you're sitting there and you're just, going to town and you're looking at your brush or your comb, you're going, whoa, be gentle. If you do have hair that's difficult, use a detangler, but be gentle to your hair in that regard. And then once again, as noted before, use good products. Those that don't have sodium lauryl sulfates or a long list of chemicals. The more basic, the better as far as cleansing is concerned, because you're not trying to, you want to remove deposits, you want to clean the scalp, but you don't want to strip the hair and you don't want to strip the scalp. Next, we'll be moving on to our fitness portion of our show. Thank you. Hi, welcome to the fitness portion of our show. Today I'm going to show you a couple of stretching exercises that you can do with your kids, particularly as long as they're not complaining of severe pain, but if they're complaining that they're just kind of achy on their back, there's certain movements that we can do safely, which will never substitute for chiropractic, that I would like to show you that a good bone doctor showed me, a bone specialist, that can be helpful, they can utilize with your kids or someone that's smaller than you. You don't want to try this exercise on someone bigger than you. You'll hurt yourself. So, what we do, this is to try and stretch out the lower lumbar region and I've done Augie a few times, so we probably won't hear any loud pops. But occasionally you'll hear a little bit of a popping as the spine gets back in alignment. What you do is you latch arms with someone smaller than you, and you use your butt in their back, to their back, and Augie, you got to relax up against here, and you bend slightly and you lift them up just very gradually, very slowly, and let them back down again. And that can pop that lower back kind of back in again. Once again, not a substitute for chiropractic, but it can help with little minor things. Another one that this great physician, his name's Dr. Blackburn, showed me, is you cross one arm like this across the shoulder, one arm like that across the shoulder, and then the person who's bigger in size uses a little bit of leverage. You get their knee under their butt, you cross your hands like this, Augie, keep it tight, but you tell them to relax at the same time. And what you do is you just lean back. You do not put full force on your own body, but you're just leaning back. And if they're relaxed, kind of lift their feet off a little bit, you'll hear a little bit of popping, and it can keep them in alignment. That'll do it for our fitness portion of the show. Next, we'll have our research analyst. Hi, welcome back to the Fit and Healthy Today show. With us today is research analyst Ralph Turchiano. Ralph?
Thank you. Now, here's a good question for you. Would you take a product that reduced your chance of having a repeat heart attack by 45%, reduce the chance of total mortality down by 1/3, and not only that, I'd like to see this verified. Now remember, this study is published in the 15th edition of the American Journal of Cardiology, but I'd still like to see it verified, cancer mortality by 2/3. Well, yes you can, and it's readily available as a food spice. This spice is called Chinese red yeast rice. It's been consumed for thousands of years, very effectively, with no known reported side effects to date. Now again, all studies need to be verified in order to be credible. One good study does not make it the rule. Sometimes it could just be the exception. However, though, from the American Journal of Cardiology, they reported, and they did the study of over 5,000 people between the ages of 18 to 70 over a 5-year period in 60 hospitals. In their own words, they said the results were so profound, even outperforming statins prescribed in numerous Western populations, that further studies should certainly be investigated. Something that we should all be investigating ourselves, especially taking some of the other medications that are out there. Now, following up, as the researchers found out from the University of Germany of Ulm, there's one interesting product you usually hear quite a bit about from grapes, wine, red wine especially, and that is resveratrol, or resveratrol, I should say. I apologize. They discovered it actually reduces the number of fat cells in the body, which is something incredibly unheard of. And most interesting also, they found it seems to reduce certain cytokines, especially cytokines which are basically related to developing certain obesity disorders, and also diabetes, among these other things like clogged arteries. It is really, really a neat substance which seems to be really cool. Now what they said was this, and their quote again, is resveratrol has anti-obesity properties by exerting its effect directly on fat cells, said Fischer-Pozovsky, which is one of the main researchers. Thus, resveratrol might help prevent the development of obesity and might be suited for treating obesity on its own. Very cool, very interesting, something else that also can be picked up, but I also recommend always research on your own too. Another one that came out for weight loss, which is real intriguing. This one just kind of caught me off guard. This one came out of the Endocrine Society's 90th annual meeting in San Francisco. And this was done by the research, or I should say Smell and Taste Treatment and Research Center of Chicago. What they are called is Tastants. Tastants are nothing more than something that heightens the flavor of food. And the reason this has such an interesting effect is it actually seems to reduce body weight just by enhancing the flavor of certain food. They took 2,436 overweight individuals, which are weighed about an average of 208 pounds apiece, and over a 6-month period of time, They just gave them something. They didn't restrict their calories. They didn't change their diet. They didn't do any of that. Each person on average lost 30.5 pounds on average. In fact, it was so effective they had a hard time keeping people inside the study because they were reaching their ideal body weight way prior to the 6 months occurring. And all it was just basically heightening the flavor of food, whether it be sweetness or saltiness, which kind of surprised me. And then basically they said total, they lost an average of 15% of their body weight, the results showed. Very interesting, very intriguing, and they said it's something that you could do on your own, totally, just by basically enhancing the flavor of certain foods, which I found very interesting and simple to do. Outside of that, now for more of the warning signs. Is drinking tap water safe for pregnant women? Well, out of the Institute of Occupational Environmental Medicine at the University of Birmingham, out of Britain, they looked at 400,000 infants, and they looked at birth defects and also local water supplies. They discovered that the chlorination of the water caused, directly related, holes in the heart, cleft palate, and also caused neural development to basically fail or break down, in addition to missing the top part of the skull or the skull cap. And interesting enough, again, it was all related to the levels of chlorine in the water. Now, the sad part about it is, in the United States especially, there are other ways to purify water, like ozonation and other elements like that they do through the rest of Europe, which we can do here. Why we don't do it, I don't know. In fact, the EPA out here recommends that you can have as much as 4 milligrams of chlorine per liter of water. Amazingly, in your swimming pools, they don't recommend you do any more than 1 to 3 milligrams per liter. Very interesting. And then, my favorite segment, as I'm going to start calling it, is what were they thinking? Well, this one goes out to Kellogg's. Kellogg's decided to make candy in the shape of Legos. I'll just read you a quick quote since we're kind of limited on time because this words it up the best. I would love to know what sick person at Kellogg's came with this genius idea. I just spent the first 3 years of my son's life to try to get him not to eat blocks, and now you're telling him they taste like strawberries. Thanks a lot. Seriously, how in the world does this ever get past our legal department? You can't tell me that this is a lawsuit just waiting to happen. I can only assume that your next product is going to be fruit-flavored thumbtacks. Well, that goes out to Kellogg's, and what were you thinking? I got no clue, but I recommend don't get your kids started on candy-flavored Legos. It'll save a whole lot of grief in the future. Well, thank you.
Thank you very much, Ralph. I hope, once again, that this show inspires you to do further research and look into changing or doing whatever you need to do to make your life better. Thank you very much.